gives me hope in this field, and it's actually pretty prevalent in other areas of medicine as of late, is this idea of looking at the individual as a whole, right? You know, for many decades, we had this reductionist medical approach. You know, the cardiologist only looks at the heart, and the gastro only looks at the gut, you know, and I see more and more the medical world getting into more of this functional integrative approach. A lot of the things that you have mentioned, correct me if I'm wrong, seem to fall into what people categorize as mental health, right? Yet we're talking about it from a neurological point of view, right? And one of the things that I was wondering in your practice is, do you see yourself zooming out a bit more? For instance, let me give you an example and see, please keep me honest. You know, I mean, we know the nervous system, you know, has a number of different parts, right? You know, and you know, you have the parasympathetic, you know, and you have the CNS, the central nervous system, you know, and then you have, you know, as of late, the enteric nervous system, which, you know, you have all these neuron-like cells in the lining of our gut biome, right? Of our lining of our gut. So what, all of a sudden, if we don't eat well, our gut gets imbalanced. That shoots up signals through the vagus nerve straight up, and now hormone regulation in the brain goes out of whack, right? And I'm just thinking I'm having a bad day, but it's not a bad day. I'm just not eating the way that I'm supposed to be eating. I'm damaging, you know, my second brain, as they call it, because of what I'm choosing to eat, or because I'm choosing to eat during a moment of stress or anxiety or an anxious moment, right? Do you see yourself in your practice applying these types of principles and giving your patients this type of information so that they can then make changes to their ecosystem? Because at that point, then it's about the epigenome, right? It's how do you architect a household type of life, at home or at work, with family, with friends, co-workers, so that you give yourself a better chance?
Yeah, you mentioned a lot of good points, and let me just start. You mentioned mental health, and so there's a difference between mental health and brain health, although they go one-on-one together, but mental health is more behavior, so it's more anxiety, depression, bipolar, so all that would be mental health. Then brain health is more cognition, but they go hand in hand, okay? So that is with that. And you were mentioning about like we are one body, you know. Unfortunately, for good or for bad, we have too many subspecialists, and I'm one of them. So it's not that I'm praising for it, but it's true. I mean, you have to treat the patient as a whole. And one downside that we have here in Central Florida, I would say that there is a fragmented system, let me tell you. So you as a patient will go to a cardiologist here, an endocrinologist there, and a neurologist here. So we're working on seeing how we can combine the medical record, share information, and all these things now with AI and et cetera to help get that information from all the different sources, because at the end of the day, as you mentioned, whatever happens here is going to affect over here as well. Yes, so the important that you mentioned about like the enteric system and how neurological conditions are actually related to that. We're seeing more and more evidence on that, not only from the memory standpoint, but we see it even for migraines, for example, and that we do diets for migraineurs actually that may have absorption problems, et cetera, and that's one of the triggers for them. So we see it not only in memory, we see it in migraines, and in Parkinson's, for example, patients have decreased absorption even of the medicine. So how they are taking pills and only 10% of the medicine of the levodopa will reach the brain, and they have delayed gastric emptying, and then the pill is just sitting there and we don't know when they're going to absorb the medicine, and we see the symptoms that they just fluctuate. So whatever happens in the rest of the system, yes, it does affect the brain. I'm trying to educate the patients as much as I can, obviously. It's being hard because you're trying to change somebody's, belief for the longest. And unfortunately, as well, there's good information, but not as good information online as well. And everybody reads or looks in Google, so I get a little bit of a pushback, but I didn't read that. It didn't say that over there. I didn't know. How come the migraine come because something that I ate, or how... And so it's challenging because on top of that, we have this amount of time to spend with the patient. I wish I could be the whole day with one, but education is a huge deal, and for me in particular. So I'm looking for different ways to educate the patient, not only at the clinic, but this is one of them. That's one of the reasons I'm here. I want actually people to listen to what I have to say. These things that I can, maybe I don't have enough time for, being 2 hours with each patient. But this is, yes, I'm a true believer about that, and I try to educate. But yes, we do get some pushback, especially. Because it's not the comfort zone anyways of the patient. When I tell you, just don't eat this or don't eat that or do exercise, how much difficulty I still get from the patients to understand that it's not only the diet but the exercise, how good it is. Mm-hmm. Most of them will say no, I didn't see any benefit. So I mean, the benefit of exercise have been tremendously explained and in research and all that, not only for the heart or for the weight or for the sugar. It also helps with the amount of oxygen that gets to your brain. It helps with the amount of neurotoxins that are being produced, like for example dopamine, and so there is a lot of benefit. I mean, I don't know if it is because it's free that everybody maybe they have to pay, or but it's still like the basic stuff. It's a challenging to actually try to. I feel sometimes seeing myself trying to convince somebody. Mm-hmm. Some of them are open to the option and they will try it, but some of them, especially the elderly, are still a little bit more problematic to do so. And now that we mentioned exercise, just really quickly, cardiovascular activity is really important, but strength as well. So adding strength exercise is really important to all this.
So let me throw something at you and see if this resonates and you can expand on it. This is one of my favorite topics of conversation, is the evolution of the human brain. You talk about cognition, is central to what you do, is that cognitive ability, cognitive reserve, as you mentioned mm-hmm. earlier. And we live in a very different world today than when this version of our brain evolved. Our ancestors, depending on who you talk to, the current version of our brain is either anywhere between 150,000 to 300,000 years old, right? And evolution takes a long time. But our ecosystem has changed dramatically. Mm-hmm. And last time I checked, the brain doesn't create new areas of cognition to deal with new social problems. The brain is basically processing everything that comes as it comes with the hardware that it has, mm-hmm. right? Because evolution is very slow, and social change is very fast. Mm-hmm. So we are at a disadvantage, right? Because we are bombarded every day, from our devices and the news. Our ancestors didn't know what was happening 3 miles from where they lived, right? And we know what's happening in Ukraine. Mm-hmm. Mm-hmm. We know what's happening all over the world at any given point in time. And the brain is just doing the best it can to keep up with managing all that input mm-hmm. that wasn't prevalent mm-hmm. in the past. Do you see it that way as well? And if so, can you expand a little bit?
Yes, and that's where neuroplasticity comes. That's the definition of neuroplasticity. How our brain adapts to the new environment. How that brain actually, with a new challenge, would actually at the beginning is difficult, but then when you're repeating it and when you're seeing it again and when that stimulus keep coming, that's when then this part of the brain start making connections with this one, and it's like, oh, this is what is happening, right? So that's what's the principle of neuroplasticity as well, like how our brain changes in regards to the exposure to different challenges. However, the challenges or the exposures that you're mentioning would bring a lot of stress as well. So it's not the same to get an exposure to something, to being at the beach or whatever, and that's new, and that what you mentioned about, like, this news that we get from Ukraine or from, so the exposures can be good and can create neuroplasticity and connections in a nice way that you're going to be able to use, but the exposure can actually be the opposite, right? So how do you handle the opposite information, and you choose what to hear, what information to, which one to actually pay attention to, or which one you're just not going to pay attention to it because it's going to be detrimental for your brain, because it's going to increase your cortisol levels and it's going to increase your blood pressure, right? So how much of that also you would actually try to internalize. But that's when we need to know also how to manage these days that we're living. That's when you need to know how to manage the stress that could be done in a different way. There's people that would pray. There's other people that would visualize that they're in a place that they'd like to be. There are others that do yoga. There are others that meditate. There's different ways of doing it, right? But definitely knowing how you're going to handle the stress that is around you is very important, because it's going to affect your brain in a negative way as well.
So how do we go from that, right? So we've talked a lot about these things that we can do to kickstart the plasticity process, to get exposure. The way that I explain it to my kids at one point is like, it's like going to the gym, right? If I go to the gym and I work out for an hour and I go home and I look at myself in the mirror, what do you see? Nothing, But if I do that in the next day and then I come home and I look at myself in the mirror, what do I see? Nothing. Mm-hmm. Because it takes months of consistent work before the physiology starts changing and I start seeing those results. And with the brain, if I consistently expose myself to things that are either not challenging enough or that are gonna make me negative, right? Over time, that's what the expectation is. And that's going to lead to a lot of problems. So if I'm going to change myself, I can do all these things, but I have to be cognizant of the fact that the benefit is delayed.
Yeah.
The benefit is delayed.
Yeah.
But that's for a healthy person. Now, what happens if I'm already experiencing a disease like Alzheimer's or like Parkinson's? Do these tools that could help a healthy person possibly prevent some of these diseases? Are they also useful for someone that is already experiencing the disease?
Yeah, so the sooner that you do it, the better. If you start at age 7, at age 6, you're gonna, that's gonna be there, and your cognitive reserve, you're building it up. So the sooner that you start, the better. If it's never too late to start, but the benefits are not gonna be the same if you already have the condition, right? Because if you already have it, to build those connections, as we were talking, is, first of all, the patients, if it is a little bit more advanced, they're not able to do
Correct,
what we're
yes.
talking, right? So assuming that it's early stages, that they're able to do it, yes, they are able to do it. However, the amount of abnormal deposition of these plaques or proteins that we're talking are detrimental to them as well. So my message would be doing it the sooner, before even the condition is there, would be the best. But not because you have it, don't do it. I mean, as I tell the patients, the moment that I don't tell you to do this is the moment that you really are in that stage in the condition that I know there's not a lot that can be done anymore. So the sooner the better. Mm-hmm.
What are you excited about as far as the future? You mentioned AI. Of course, everybody is either excited or petrified about it. But from a neurological point of view, from your day-to-day work, what are you looking forward to be able to use to help your patients either prevent or deal with a disease?
So what is exciting about neurology right now, as I was telling you, is that the conversation is very different because we are seeing what's happening. So prevention is number one, and being able to educate the patients much before. What is the right age to start? If the right age is when you start at school. Let's put it that way, and you just don't stop, right? But it's exciting also to have different tools to see what's happening, and it's exciting also to know that there are different medications that are out there in case we need them as well, that could slow the progression, that we're heading into the cure of conditions that didn't have a cure before. So hope is there as well. And integrating, artificial intelligence that can be useful not only for our doctors, but for patients. I tell patients, try to learn as much as you can about that, because actually that is there to help you stay independent as well the longest. Now, I cannot tell you to do that if you're already in an advanced stage of any condition. So getting to have these gadgets as tools to help you as a patient as well is pretty exciting. So I'm seeing myself right now giving hope for conditions that didn't have any hope before, and seeing prevention as a tool as well, and more people are willing to listen to this. So I think that we're gonna start seeing cures for many conditions that we didn't even have an idea that could happen before. So working hand in hand and collaborating with other doctors, collaborating with not only the patients, but also their family, their caregivers in particular, giving, talking to them, talking to humans, and that part of holding hands together. I see a good future in neurology. We're not there yet, but I see it's gonna come.
How do you see, you mentioned something that I think is very important. You mentioned two things that are very important. One of them is community, right? And there's plenty of studies, including the Blue Zone study, that actually one of the conclusions was that community is very important for longevity. Right? When you know that there are people around you that have your back in a community. And community these days is so hard because everybody seems to want to be isolated. You work and work and work, and then you go home, turn Netflix, and then continue the bombardment, right? Through the eyes, which, in itself is a bit of a problem. A lot of people don't know that the optic nerve is actually part of the nervous system, because our retina, as we are being developed in the embryonic stage, is actually neuronal tissue. There's neural tissue in our retina, so it is considered part of the nervous system, which means that it matters what we expose ourselves visually to, because things start happening or not happening as a function of what we expose ourselves to. But you mentioned community, and you mentioned caregivers. So now you have this whole world that gets forgotten, whether we're talking about Alzheimer's or we're talking about Parkinson's or whether we're talking about autism, right? The people that are experiencing these conditions have relatives that are living with them, trying to help, and they also need resources and help to be able to keep giving love to their loved ones and keep trying to improve their quality of life. I know I'm asking a lot, but I mean, do you in your practice see this, and is there anything we can do better in that space?
Yes. So we actually have caregiver support groups in our practice. We have one for Alzheimer's caregivers, and we have another one for Parkinson's caregiver, actually in Spanish. Caregivers, I see it as that's the guardian angel. That's your shield. That's you're able to manage so much, but then if you don't have that other at your side, most of these conditions that we're talking, you're not able to handle by yourself at some point in life. So choosing who's your caregiver is one of the most important things, starting with. It doesn't have to be your partner necessarily. It could be a child, or it could be one of your children, or it could be somebody else. But that's someone that you choose as part of your team, even though you don't have any problems yet. You're already looking, who's gonna be the one, right? Who's that? Because there's some people that you may not want to have around you, even though they're family. So choosing who's that person, that's, I see it, if it is a team, as I see this, and the patient is the leading player of that team, this person is just the guardian, the one that protects the blind side. You can have a quarterback over there, and it could be a very good quarterback. But if they don't have anybody protecting their blind side, they cannot do anything. They're just going to be all the so that person is that important. That person usually don't sign up for that job. So nobody called them and said, when you're going to marry to this person that is going to have Alzheimer's in 2 years or 3 years. Or so when you do it because of love, let me tell you. That's the only thing that would keep these caregivers just at their side. On the other hand, they're as human as the patient as well. So talking to the patient and letting the patient know, listen, don't take it for granted. Because I have seen elderly getting divorced. I have seen people, like, as soon as they know the significant other have a diagnosis of that sort, they would just leave. Because it's not an easy job, let me tell you. A lot of things start to be in your plate as a caregiver. And everybody thinks that you're going to be able to handle and that you have to do it, and that's not true. You choose to do it because of love, is what I would say. However, unfortunately, I get to see a lot of conditions happening in the caregivers. For example, I do have a patient that have a lot of hallucinations, have Lewy body actually, and the caregiver was the one who passed. He couldn't handle the situation anymore. The amount of stress and the amount of things in his plate were so much that actually during one of the hallucinations of the patient, he had a heart attack. So think of that, it breaks my heart, but that's the reality. And how much resources are available for the caregivers? There are not that many. I mean, there's some, but like the support group and this and that, I don't think that's enough. Caregiver burnout is huge, and there is a huge impact in the economics of the country in general. And I'm going to tell you the example of Alzheimer's in particular. We're talking about billions of dollars, billions with a B, that caring for an Alzheimer's patient means for the community. Now, Medicare and the insurance will pay just a small amount of this. The rest is coming from the caregivers, and not necessarily from the money that they put on the table, but from the time that they are not working, or they have to reduce, right, the amount of work that they do, how many forms of FMLA, of a family medical leave that I have to sign just because they have to, they cannot work that many hours because they have to care for their loved ones, or how many times they don't sleep because, their loved ones are just wandering around. So this is a huge thing, and it impacts the economic, it impacts the quality of life, it causes more burden and more even diseases on these caregivers, and we need them around. The patients that I'm talking about, these neurological conditions, at some stage, they just cannot be by themselves. So how do we care for them is very important. Actually, we have a symposium coming up here in the Aleph, here in Lake Nona, and it's a Parkinson's symposium. And my talk, I choose that to be for caregivers. So my hour is going to be on caregivers, and I'm going to be a moderator. I have 2 caregivers that I appreciate very much. One of them is a young person, a young woman, that she's in her 40s, and I actually diagnosed her husband when he was 46 years old with Alzheimer's. Do you think that at that age, when we are, having a cup of wine or a glass of wine and eating, at that same age, she's taking care of her loved one that is still young? They don't have kids. She's just there because she loves him. And so she's going to tell that story for her and how she handled it and how she managed that at a young age. And then on the other hand, I'm going to have another, so this is a gentleman, a man that his wife had Parkinson's. She passed already. And I would like you to hear also, or the public to hear, the perspective of how a man handled being a caregiver and how he went through all those stages, because I think as a community, we always see the caregiver as a female. Mm-hmm. So that's why I try to put both on that symposium. So how he managed through those stages, going from walking to a walker to like everything that happened, and less than a month ago, unfortunately, she passed. So given the resources available in the community, not only from the association, so the Parkinson's Association of Central Florida, the Alzheimer's Association, they do have some resources for that, but also from the community itself, et cetera. We're going to be talking about that. I think we just have to, this is a real thing, we just have to continue to educate, and getting more funding for this is a real priority, because it's going to be it is a problem, not only for the family, but for the government, for all these people calling that they cannot get to their job because they're taking care of the loved one. And we're going to have more and more people. So the prevalence of these conditions is just going higher and higher. So it's a social problem.
Indeed, indeed. Well, I knew this was going to happen. It always happens when you're having a great conversation. We're out of time, but I want to give you a last word. The title of this podcast is Three Thoughts On, and today is Three Thoughts on Neurology and Prevention and Disease. What three things would you want to leave the audience with after this conversation that we've had?
Yeah, so three things would be educate yourself, educate about like the new things that are coming, prevent, and in prevention, everything that we said, okay? And the third one would be don't lose hope, because a lot of things are happening, there's a lot of discovery, and I think we can be able to live a better life and a healthier life.
Dr. Benes, it's been a pleasure. Thank you for being my
you for
guest in my
having me
podcast.
here.
Thank you all that were online. We will be back here again in 4 weeks, the first Wednesday of every month. Thank you very much.
Thank you.